The ongoing pandemic. Welcome to Law and Society. Please subscribe. We're going to talk about the ongoing pandemic that has been ongoing for 40 plus years. And without outreach, awareness, and prevention, it will kill humanity. I'm talking about the HIV/AIDS virus and the pandemic. The HIV virus is an insidious virus that one can transmit from body fluid exchange. And what it does is that it is a virus that replicates and goes into the cells and replicates in the cells and then bursts out and goes and attacks the immune system. It's a contagious infectious disease. And in the 1980s, early 80s onwards, to this day, it doesn't have a cure. So it begs the question, why is USAID making cuts to HIV prevention programs around the world? Why is the Department of Health and Human Services under Bobby Jr. cutting infectious disease awareness prevention policies that include awareness of HIV? Mind you, this impacts the lower income group in the United States and the devastatingly destitute and sick around the world, many of whom at least one child has died because of lack of medication in Africa. We don't know what's happening because we don't have the news from those places anymore because those offices have been shut down. What is the end goal? Kill all those with HIV? If you can't pay for your HIV meds, you don't deserve to live? Because that's opposite everything a world full of scientists and policymakers have been trying to do since HIV entered the world in the early 1980s, with a lot of American help, including USAID, CDC, FDA, and the whole world, including the World Health Organization, USAID, UN, whatever international governmental agency that you can think of has a program for HIV/AIDS. I worked for a time in Chicago's largest HIV/AIDS LGBT health care services organization. It was called Howard Brown. And, that's the stance that the federal government gives you funding in order for prevention and in order for you to be able to produce literature and programs of awareness. So anything as simple as providing free condoms in colleges to providing HIV medication at no cost if you go through the public health system is what is being undercut at the moment. This will create outbreaks of HIV throughout the country and the world, and without state resources, many will go untreated. This will increase the incidence of transmission of the virus. It is a death spiral because we know that abstinence-only programs do not work, and because there's no such thing as HIV becoming endemic. HIV doesn't become endemic. HIV kills you. It kills your immune system, and then some opportunistic infection kills you. And what the medicine does is keep the viral load down, keep killing the viruses as they are replicating within the cells. So without the treatment, without the prevention, without the awareness, without the treatment, this disease will run amok. It threatens the global human population, and if allowed to run amok, will kill humanity. Not just the United States, but in the whole world. So why is our government hell-bent on quietly but decisively neglecting HIV prevention, awareness, and treatment programs? Why? Because it impacts the gay population disproportionately in the US. You can look at it as an assault on that demographic, along with an assault on the poor around the world and in the United States, because it will impact the poor the most. You know, if you go to public health buildings, you won't find rich people there. Rich people don't care or need Social Security or the public health programs that the HHS would fund, that so many Americans rely upon. So how can we get these multimillionaires and billionaires to understand that these programs are necessary for vast swaths of the population? And keeping these programs funded is the only way to keep HIV at bay until there's a cure. And after 43 years of creating horror around the world, killing millions and millions of people and infecting even more, there is no cure for HIV. And I wanted to come out and talk to you about this infectious disease that the Trump administration seems to be retreating its support from. It has never happened before, because when it struck the United States, it really devastated the gay population, gay men, and also then went into blood transfusions and then spread into the general population because, you know, people didn't know how it was being transmitted. So before there was realization that it was being transmitted through blood transfusion, the transfusions already made. That probably will not happen this time around, but the infection will rapidly grow in the population. So that should give reasonable people pause before cutting these programs. But we don't have reasonable people at the head of the HHS anymore. It's Bobby Kennedy Jr. We don't have the scientists who take care of vaccinations. We don't have the scientists who are doing research on HIV prevention and HIV treatment because they're being fired. So we don't live in the world anymore where there are reasonable people in places that, govern such important things as keeping this monster of a virus at bay. That's the best that humanity has been able to do in the last 40 plus years. And so, why is the government cutting programs of infectious diseases, including HIV? This is a contagious disease. It is a sexually transmitted disease. It can also be transmitted through bites. It can be depending on the viral load of the people biting. It is also, once it gets to the critical point of having destroyed the immune system, it becomes AIDS, which is acquired immune deficiency syndrome. So you have an immunodeficiency at that point, and you are also highly infectious at that point. And without the testing services, the awareness, the treatment, the prevention programs, those people who do not know that they have HIV, or even if they do, they cannot afford the medicine because it's not being provided for free by the Department of Health anymore, their viral loads will keep going up. Will their personal practices, their sexual practices, social practices change? Does the risk of them passing that along by transmission increase or decrease? It increases exponentially. It endangers society exponentially. And there's no good reason for it other than to target poor people and to target the gay population and to target people who are shielded from the awareness of this disease and other diseases. And that's why we're seeing outbreaks around the country of measles right now, which is a multi-state outbreak at this point. And, Bobby Jr. is dismantling the HHS, the CDC, firing vaccine regulators and hiring propagandists. This is something that people need to talk about. And I haven't heard anybody forcefully come and talk about this particular issue, so I figured I'd come and tell you about it. I hope this has been informative. I hope that you will call your senators and your representatives and push them to not cut HIV prevention, treatment, policy, research programs, testing programs, and that these are of critical need in every community in the United States and in the world where they cannot afford the medicines themselves, where the countries are at war, where the country is going through a famine, where the government is destitute. With that said, please take care of yourselves. Please like and subscribe and share this information, not because of my views, but because this is the information that needs to go out so people can call their representatives and senators in the federal government and representatives and senators in the state government saying pulling this state funding is going to be a danger to society. It's going to increase the incidence of infectious diseases. In a sexually active population that America is, it is going to spread HIV, and it is going to make America sicker than it has ever been. With that said, I know it's gloomy, but please do share this and call your representatives and political officials and talk to them about it. Talk to the big city aldermen and the mayors to come out and speak about it. Because every major city has an AIDS foundation and an AIDS organization that does outreach, treatment, testing, prevention programs, and research for cures. It's all over the country. And it's all over the world. And the American government subsidized it because that's what it took to keep Americans and people around the world safe. Because that's how dangerous this disease is. And we don't have a cure for it. Thank you for listening. Take care.